The opinions expressed on Plastic Fantastic are intended for educational and informational purposes only and are not meant as a diagnosis, treatment, or substitute for professional medical advice. The mention of any product, treatment, or procedure on the show does not constitute an endorsement or recommendation and is purely for the information and education of the public.
Welcome to Plastic Fantastic, a weekly show dedicated to the latest in plastic surgery, aesthetics, beauty, and wellness. Now, here are your hosts, board-certified surgeons Dr. Robert Silich and Dr. Olivia Hutchinson.
Good afternoon.
Good evening.
Good morning.
And good morrow.
There you go. Good lady, Dr. Hutchinson.
And kind sir, Dr. Silich.
Welcome to Plastic Fantastic.
With Dr. Robert Silich.
Oh, once again. And I guess Dr. Olivia Hutchinson.
You can't hear the names enough.
What are we talking about today?
Beginning of summer. We've just had our Memorial Day weekend, which was very enjoyable, I'm sure, for everyone, for all involved. And now we have officially or unofficially, however you want to describe it, entered the 3 months of summer. It's only 3 months. Can you believe it? July, August.
Yeah.
It goes by so quickly.
It does, right? It flies.
Time flies when you're having fun.
Doesn't it, though?
It does for
I guess
me.
it does. Yeah, so we're getting really into the thick of summer, right? I guess we're in June, so that's good. Or at least we're on the cusp of June. June is tomorrow.
We're teetering on June.
There's that word again. Makes you laugh and giggle every time I say it. I don't know what you're thinking.
It just sounds funny when you say it. I think of what's that game on the seesaw? Teetering?
Oh, yeah, I guess that is you teetering on the edge.
Yeah. Teetering on the edge of falling off the seesaw.
Falling off the seesaw. You know,
do they even have seesaws anymore?
Totally. Oh,
they do? Okay.
They're very complicated.
I thought that people... Complicated?
Yeah, they look different.
Well, so that you can't bang yourself when you come down too fast, right? Wasn't that part of the issues? Or if the person
kind of like those toilet seats where you drop them and they slowly go down.
Yes.
Yeah, I get it.
Those release soft clothes.
You're thinking of like the Roadrunner where they drop the big weight on one end and the
and
poor coyote
flying.
takes off into the next town.
I think it's a great way to learn physics, though.
Oh,
you
boy.
know?
Don't remind me. Don't get me started and don't remind me about physics. That was a tough one.
You didn't like it? It's like all the
physics
practical
was the most
applications.
practical application. So if you have a great professor, physics is wonderful. It's a really fun thing to take.
You have two trains that are coming in. That's
that's
math.
math. That's horrible. I still get like a butterfly twinge when I see those questions.
You have PTSD?
No, but I still
From
have
your
the
pre-med
I have the dream.
requirements?
I have the dream of the missing out on the class.
Missing out on the exams.
You find out 5 classes instead of 4, but you thought you were only taking 4.
This is therapy
and the
session.
finals the next day. Totally. Every doctor I know has got some version of that one.
Yeah, because we're under so much stress.
I was going to say, even though it's summertime, it still feels different. It still feels like pace is different than it is in the winter for us, right?
You mean in terms of our work?
Yeah.
Or you mean just like how quickly you get across the street?
No. I think in terms of our work. Obviously, we're not school teachers and we're not students, so we work all through the year.
We are teachers, a matter of speaking.
Yeah, but they don't have a spring break for the teaching we do, or a summer break or anything.
No,
we go
work,
right through.
We work full-time.
Yeah.
And full-time 12 months.
But the summer feels different in our practices, doesn't it? So the pace is different. I don't think we operate less, but I think the pace is different. I don't know what that means.
I don't know.
I just wanted to say it. I know. Clearly you don't agree with me. You're just leaving me out there.
We do operate a little bit less. No, I'm surprised that you say that because I think that people in general aren't around as much.
Certainly in this town, in the end of August, it's very tough for us to justify a full week of work because I think towards the end of August, people go away. Even our staff go away.
Our anesthesiologist goes away.
She goes away. She deserves a break.
Everybody deserves a break. By the way, I think if anything, we've noticed that with the effects of the pandemia, I think people have really taken a step back and just mulled over what choices they've made and what is important to them in terms of their lifestyle. Going forth, what kind of requirements they have for their work environment or lack thereof, since so many people are staying home. But the number of, I'm going to say kids, even though they're in their 20s, young people who are maybe on their first or second job out of college, who have very strict requirements in terms of what they will accept or not accept from their employer. And also the number of people who have unlimited vacation. It's not specified anymore. It's like, take as much as you need kind of thing. So a lot of
You mean
changes.
in jobs for young people now?
In jobs,
they really
yeah.
do that?
So, and of course, I mean,
Wow.
you're still expected to perform. So it's not like, well, you can just not show up ever and we're still going to keep you, obviously. But it's not that very detailed phrasing that says, well, after you've worked for the first 6 months, then you get a day of vacation or whatever the concept might be. So it's kind of put in their lap to decide how much they need need as far as vacation. And if they go away, again, related to the whole working from home, if you're going to be on vacation, you can actually do work while you're not physically present in the office. So there's a much more fluid type of setup and environment, which is probably good as far as people who are able to work from home and can kind of get themselves up in the morning and be productive. And that
I was going to say, you have to be a little bit more self-disciplined to do that, though,
Absolutely.
because it's very easy to just be like, whatever. And some people
would just not
like
show
that
up.
structure. No. I think I'd be pretty good about that.
You'd be like, I'm going to take my bass guitar over here.
No, because you know what? You and I really work all the time. Like, we have a lot of time where we can kind of do whatever we want, but we're kind of still on the clock.
Well, also because we're always available for our patients.
That's what I mean.
which is
So in
very
other
different.
words, right, it could be a Saturday night, and obviously we're out to dinner or we're doing something, but we always know that within the hour we could get called and be standing in the emergency room.
Right. And what I like is that no matter what time of day or night I send you a text, I know I'm going to get a response
Right away.
immediately because you never turn your phone off.
It's always on. I'm always doing something stupid. That's right. I'm always watching
You
something.
heard it here first,
On
ladies
the
and
Plastic
gentlemen.
Fantastic. Email us, by the way, on this stupid...
Ask us about what
this
stupid things Dr.
stupid thing I'm
Silich
doing in the middle of the night at plasticfantasticshow@gmail.com.
I think nobody heard that. Can you say that again?
They
what
heard-
the email address is?
plasticfantasticshow@gmail.com. And you can find us on all major podcasting streams such as
YouTube,
iTunes, Spotify,
That's it.
Spreaker. No, there's a lot. There's a
Spreaker.
lot out there. You could find us. Easy.
And YouTube again, in case you missed it the first time around.
and the YouTube. Anyway, so summertime blues. Are you going away this summer?
I'm going to try. But
Where are you going?
I don't know yet.
Where do you want to go?
Everywhere.
Give me an idea, though, because you take very interesting vacations.
I'd like to go someplace I haven't been before, but I like to go places. Oh, we were talking about this the other day.
We were. You like to learn something.
I like to learn something,
Mm-hmm.
even if it's not organized. You just pick up so much, and I'm sure you've done this too because you like to travel. But
I like to learn things when I travel. Like,
you learn things just from being in a different place, right?
Right.
Where you don't have to go and study the history of the town or of the country or whatever, but just walking down the street, you get so much information about what the stores look like and what the people are like,
how they
the language.
mix the martini at this bar compared to the one
Most
3 blocks
importantly,
away. Exactly. You learn something.
A lot of the food recipes.
Right. How is the steak prepared?
Spices.
Exactly.
And then ultimately what's really nice is that you figure out that we have more in common than not with all of these people from all over the world.
Right.
But the other thing that's very interesting is, especially coming from a place like New York, where there is so much diversity sort of built into the city and into our social fabric. You go some places and you realize it's much more homogeneous. And that's also something that you just kind of, as a contradistinction to what's going on here, you sort of notice, if you go to this country, everybody kind of looks a lot more the same physically.
And certainly their histories are more homogenous than ours.
And even something like the languages. I mean, we talked about this earlier, the number of people that speak a different language. You'll take a cab or whatever and different name, where are you from, all corners of the world. And that's something that's pretty unique.
You're talking
in
about
the
being
city.
here.
Right. And then when you go abroad, you see that there's a difference. And so you appreciate things about your home, as well as learning about what goes on culturally and socially and politically in other places. So it's always nice to go away and try different things. I don't like to go places where there's no running water.
My God. Of course not.
Like the Amazon
Are
forest.
we really going? I know that's not where
People
we're
like
go.
to climb
Rough
Everest. Yes. I'm not sure I would do that either. I'm not sure I would
I wouldn't do it.
K2 or Kilimanjaro or any of those. I know people who've done it and I think it's fabulous.
It
and
looks scary.
clap, but I like to see those in photos or the David Attenborough
On Netflix.
series.
I
Right,
got you.
about
Wow, look at those
planet
guys on
Earth.
Everest. Isn't that great? Can I have another potato chip?
They must have some trouble breathing.
Right.
The worst thing, though, was we heard, this was, my goodness, it must have been 15 or 20 years ago, if not longer, John Krakauer, who summited
Yes. Into thin air.
and then wrote the book, and it was a very sad story. But he also talked about the frostbite that happens, which people don't necessarily think about. I mean, they think about how strenuous it is to get up the mountain and the lack of oxygen, the Sherpas that do all of the prep work and everything, but you don't really necessarily think about the fact that people actually lose digits from the cold.
Yeah,
and of
noses,
course,
digits,
all the
lips.
tips and the reconstruction that sometimes they have to undergo.
That's
so
horrible.
it was
See,
fascinating.
that's not worth it to me.
Yeah, to lose appendages.
Yeah, I mean, I lost my thumb, but I got to Everest, Summit Everest, whatever.
And people also lose their minds in some cases.
No, that's very
because
frightening.
of the oxygen deprivation, or they go psychotic episodes. So none of those things are going to be on my
That's
bucket
not what
list.
you're doing.
No,
I got
skydiving,
you.
another thing, not on my bucket list. But I would much rather go wine tasting. That would be very fun. They have these organized groups where you can ride your bike and then pull over if you've had
And you're
enough.
talking not just in California, you mean all over the
Just
world.
all over the world, yeah.
Right.
You know, a little bit of exertion. Exercise is great for the body and soul. And if you go at your own pace, you can certainly enjoy the pretty views. Fresh air, of course, we don't get much of that in the city. So, although Central Park was very nice the other day, it was very quiet.
I assume I'm going to be covering you during this trip, because as you're
haven't
describing
planned
this, I'm
anything.
listening to this, I'm like, man, I guess I'm going to be staying here covering the house.
I haven't planned anything
Wow.
yet.
I know we both haven't. We're a little bit late. We got to get on it, right?
I know. So it's hard to coordinate
We've
everybody's
been working a
schedules and
lot
stuff,
still.
so-
It hasn't really changed, so that's a big
Are
difference.
you going to go to London? You think that's going to be your primary?
Well, as I was saying last week, I'd love to, but it's tough because, there's a lot of stuff going on in London in June.
I'll tell you the important reason to go now in the summer is because to Europe, if you want to do that, is because the dollar and the euro are pretty much near parity right now.
That's great for
which
us.
is kind of crazy when you think about it. Because I
wonder
think
about
usually
the
it's like-
pound. It's probably similarly good, I would hope.
well, that's one place that I've been thinking about going is maybe British Isles or Scotland, Wales. Those I've never been to that part of the.
When was
I've
the
only
last
been-
time you went to London?
That's been years
Yeah,
too.
go. Trust
So-
me. I'll set it up for you. I'll write out exactly where you should
Okay,
go.
you're on the hook. You've been recorded.
a
on the
martini
Plastic
a martini a
Fantastic.
night, and you'd be happy, and then some. No, you'd
And
love
it's
it,
an
and your
easy
kids
trip,
would love
too.
it. Yeah, it's an easy trip.
If you have any recommendations,
They
for me
speak
when I go
English
to
over there. It's amazing.
and I'll speak French to them. So
Absolutely.
we can be from across the pond. Please send us an email with any thoughts, comments, suggestions that you may have. Our email address is plasticfantasticshow@gmail.com. You're listening to Plastic Fantastic
On
with
all major podcast platforms with Dr. Olivia Hutchinson.
and Dr. Robert Silich.
By the way, I never mentioned this enough, but we're also on the Instagram
on the Instagram.
if you want to see what we look like.
But you can't listen to us on that until we figure out how
Not
to
yet. We
play
got to figure out
reels.
how to do that.
We can
yeah.
just do
We're
like
gonna-
little snippets.
we'll
Best
figure it
of.
out.
We'll do that. We're going to work on that during the summer. How
Good
about that?
call. Good call. Wow.
We're going to take a quick break and we'll be right back.
This is Plastic Fantastic with Dr. Robert Silich and Dr. Olivia Hutchinson.
Is just a starting line. For the true self blooms only when we find our purpose, what makes us tick below the surface. My why is diversity in unity, a safe space in my community, living with sincerity, giving every day my everything. With my why, I stand strong, seen and supported all along. It's a million faces in a mirror and everyone belongs. Find your why. Learn more at ymca.org for a better us.
Yo! Sorry, man. I took an upper to stay awake. My heart started pounding, so I took a downer to take the edge off. Honestly, I feel worse now.
What? One of my friends overdosed after mixing drugs like that. I don't want that to happen to you.
Yeah, I definitely won't be doing that again.
Well, let's stay online for a bit so I know you're okay.
Yeah, man. Bet. Let's go.
There is no safe way to mix drugs. Learn more at cdc.gov/stopoverdose.
Here's tips on skincare products to save you some time and money. Fine lines and brown spots are often caused by exposure to the sun. If you can do one thing and one thing only this summer, wear SPF 50 sunscreen.
Anything higher doesn't give you any more protection, and you're actually paying more at the store for SPF 75. Make sure to cover up exposed areas in prolonged periods of time in the sun. Wear a wide-brimmed hat and sunglasses to protect your eyes and the skin around them from harmful UVA and UVB rays.
And it's very important to reapply sunscreen several times a day. Just because your sunscreen says it's waterproof doesn't mean that it really is.
So be sun safe and prevent skin cancer. This message is courtesy of the CDC. Find out more at cdc.gov. That's cdc.gov.
Plastic surgery for a rejuvenated, revitalized you. This is Plastic Fantastic with Dr. Robert Silich and Dr. Olivia Hutchinson.
Let's do top 5 procedures in the summer. Number 5 is...
Lipo.
Yes, exactly. You wouldn't think that would be it because a lot of times in the wintertime you got to cover up with those garments. Lipo is a big one in the summer. That's a good one.
For a number of reasons, I think because the incisions are so tiny and they can be hidden pretty much in very inconspicuous spots. So you don't have to worry about a big scar being exposed.
Right.
Also, the anesthesia that we use is sedation anesthesia. So patients recover very quickly from that. You don't have to go under general. There isn't a lot of swelling or bruising that happens. Sometimes there can be quite a bit of bruising. But again, that goes away very quickly. And then the restrictions on activities, not as scary, let's say, if you have an issue after that because you don't actually have a lot of dissection and cutting going on. The one thing that's interesting with liposuction is, as you know, but we're going to say this for the listeners, even though we remove all the fat at the time of surgery, it takes several weeks to months before the skin redrapes, before it contracts back down.
There's a space that we create in between the skin and the deeper layers, such as muscle, where the fat used to be, that's now missing, that the body instantly sends fluid to, blood, reactive inflammation in those areas that has to be reabsorbed, and then overlying that, the skin has to now redrape and contract over those new spaces. So that does take a while.
It takes a while, but it's also a very gradual thing, so it really doesn't prevent you from engaging in activities.
Right.
So I think that's a very nice, I don't want to say selling point because we're not really selling anything, but it's a nice aspect of the liposuction procedure in general, is that you can encourage patients to understand what they have to look forward to. And it's also one of the procedures, I think in general, our patients are very happy because you and I spend so much time making sure that we identify the people who should be having plastic surgery and not operating on patients who aren't ready for any number of reasons. But liposuction patients, I think, are some of the happier ones too, because they can have a significant impact on their lifestyle. And just to reiterate, it's not a method of weight loss.
No, fat weighs almost nothing. In fact, always in the beginning, people weigh more after the procedure because their body's holding on to fluid and swelling stuff like that. So that's number 5.
Yeah.
Number 4 is
eyes.
Eyeballs. Interesting.
Well, not ball.
Oh, easy with that. Exactly.
Eyelids.
Eyeballs. Operating on the eyes. Yes, it is actually. And it's a bigger thing now, I think, because people wear sunglasses a lot in the summer, and they're also wearing masks, and they're on the Zoom. And yes, it's not one of those things that particularly needs any kind of cold weather or any kind of significant restriction, except for about 2 weeks of no exercise, although you'll feel like exercising pretty much right away.
Plus, everybody wears sunglasses in the summer.
That's right.
Because of the sun. And now
eyes.
Big sunglasses are in.
Good one.
Incisions are very nicely camouflaged within the eyelid crease for the upper lids,
right,
or right underneath the eyelashes. And then, of course, there's some patients, especially the younger patients, where you don't have to put an incision on the lower lid at all because everything's done from within. And that's really, we love that. And the patients love that too.
And the patients love it.
So literally, I think that's one of the few occasions where we can say scarless surgery.
That is actually scarless surgery because we hide the scar inside where you can't see it. So true.
It's a good one.
So that's a great one. Number 4 is eyes. So we've got liposuction, number 5. Number 4 is eyes. Number 3 is, wait for it,
noses.
I actually have noses as number 1, but let's do noses as number 3.
Really?
I know what you're waiting for number 1. I know which one it is. Okay, noses.
Well, we can say something
Big
else.
one. And I think the big up tip for noses is primarily in that school age category. It's usually people that are transitioning from high school to college or after college before they start work, or even in between high school and college. I think that's a big jump for those. I've also seen, we'll put this as like a little asterisk underneath the noses, otoplasty as well, which is ear reduction, is kind of a tie, I think, for third place.
For prominent for those
and again, done in that transition zone between schools or starting to work and stuff. So that's a good one.
And I think definitely before they go to a new school. And to your point, noses are very popular at the end of the year or before the new school year starts, because kids graduate and start a new school. They really want to go in as a redefined version of themselves, new and improved. I want to look better, just not different.
Well, we like it when people say that, and hopefully they'll be happy with looking better and not different, which is true. Because looking different but not better, that's not really that good.
I don't think anybody really asks for that.
That's not a good one.
That's definitely a red flag.
A red
if somebody
flag
says,
if they ask
I don't
you
want
that.
to look better, just different. And unfortunately, we do see quite a few, not that there are ours, of course, but we've seen results
Let me
of
look
patients
different.
who
Make
look
me different.
But I don't know what they've asked for. They definitely look different and not better. I think that's the end result, is not what we would hope for our patients.
That's true. Do we have time to do the top 2, or should we take a break
no,
first?
we have more time.
Do we really?
Yes, I know.
I should have made this a top 10 list, but
Okay,
we're
we
going to
can
make
go
it.
back and
we're
add
gonna
some
make
more.
it number 5.
We could
I
talk
think
about
number.
top 5
I
in
think
the
number
winter.
2 is microsuction, which is kind of like
I was
a
gonna
form
say
of
next. Yeah, I
liposuction.
was
but
gonna say
but
next.
that's your neck. Always easy to hide and hard to see, so that's a great operation to do. Microsuction is basically a form of liposuction along the jawline and underneath the chin that we love to do. That's virtually indetectable. Neck lifts, also hidden behind the ears and sometimes under the chin, also a good thing to do. And in the age of Zoom with masks and with the pandemic and wearing masks, almost imperceptible for people to see that you've had something done. And even then, it's only for about 5 to 6 days where you're really going to be bruised. Again, same thing about activity and exercise, but you can go to the beach, you can sit outside, you wear sunblock, obviously.
And same thing with all of these procedures is that the vast majority can be done under IV sedation. You don't have to put patients to sleep.
Yeah, you and
So,
I rarely put people to sleep. We do sometimes with the body stuff, right?
yeah, if you're doing major sort of tummy tucks, that kind of stuff. So, which is not our number one
No,
procedure.
but we do it together a lot, which is
Yeah.
good. Make it speedy and fast and easy. All right, so number 1. So let's just review again. Number 5, liposuction. Number 4 was, I don't even remember now. My God, what was number 4?
Eyes.
Eyeballs. Exactly. Number 3,
We are
noses.
not ophthalmologists. though.
Noses / otoplasty. Number 2, neck lifts and microsuction. And wait for it, listener. Number 1 is microneedling, PRP, and fat transfer. Why is that?
Because it's the best thing out there for your skin.
Well, it's certainly the best thing out there, but it's also really quick recovery.
Yeah.
Fat transfer, microneedling, great procedures.
And the nice thing about it is that it addresses different areas from the superficial to the deep. So the microneedling is a resurfacing procedure where the skin is helped with the treatment, create tiny little channels in the skin with these minuscule needles that penetrate through the epidermis and dermis. And that stimulates collagen and elastin production. And it also helps with skin turnover. So you get rid of some of the superficial pigmentation and fine lines, and as you know, also really helps in terms of scarring and acne scarring and pock marks and these types of things that patients come in with. And what I've seen also is that it's very helpful also with stretch marks, which again,
acne scarring, stretch marks.
yes, which
large pores
have to do with the skin itself. And then the fat transfer that you were talking about helps with volume. So we see so many patients who come in, especially for facial rejuvenation, who are maybe not ready for a full facelift, who don't want to have that pulled, windswept look, who are maybe on the younger side where they actually don't have all that much extra skin. So they ask for a more modest procedure. And I think the fat grafting procedure, which really helps with volume, and combined with the microneedling and PRP, which is platelet-rich plasma, which sort of helps the overall effect of what microneedling does because it's full of growth factors. I think the combination procedures can really give you a very natural and improved look to appearance to your face. And patients are just absolutely thrilled because it doesn't seem like a lot.
In the older days, which is not even that older, before microneedling and PRP became such a big thing, the kind of skin resurfacing and tightening that we were talking about really was relegated to lasers. And lasers are very tricky on people with darker pigments or even medium pigmented skin.
Olive skin, right?
Olive skin, Mediterranean. Certainly black skin and Asian skin can be very difficult with lasers. And also that time of year when there's a lot of sun, even walking down the street in New York, you'll get sun coming off the sidewalk. So microneedling and PRP has really revolutionized a lot of that because the recovery's faster, the result is great. It even looks a little bit like a sunburn. Your skin is kind of flushed for the first 8 to 10 hours, which is great. So that's a big one.
And the other thing that's nice about microneedling is that it's adjustable. So there are different depths of penetration. So you can do a more superficial one, which is generally around 1/4 or 1/2 of a millimeter in depth. And then it goes all the way up to 2 to 2.5 millimeters. I would also caution the listeners who might think that deeper is better or bigger is better or higher is better, because there are some claims which are clearly not correct, that there are instruments that will do microneedling to a depth of 5 millimeters or even 10 millimeters.
Yeah, great idea.
Which is absolutely absurd.
Which is now, by the way, past the skin and into the
your
fat.
bone.
Right, exactly. So
depending on which area, especially around the eyes or the face.
Bigger is not always better. Exactly.
So
and deeper is not always
you
better.
You can't always believe everything that you read or all the claims. No, you really can't. I mean, we sound like a broken record here, always saying this sort of thing.
Somebody should have told me you can't believe all that stuff.
Even at the 2 millimeter or 2.5 millimeter depth of penetration, which is a very significant depth, there are fabulous effects from that. You are going to be a little bit redder, but again, it's very quick. It's maybe a day or two, and patients can wear a big hat or wear glasses around their eyes when we treat the skin around the eyes, but it's a very limited amount of time.
Balaclava, you could wear one of those.
There you go.
The big ski mask, you could get away with that.
In New York City, I think you can wear anything you want.
No one's going to look twice at you. You could be naked. They're like, there's a naked guy in the corner, hell in a
Whatever.
cab. Whatever. What time is it? You're listening to Plastic Fantastic with Dr. Lunch Date Olivia Hutchinson.
And Dr. Robert Silich.
We're talking about summertime, the beginning of summer, as I've been reminded numerous times during the show.
Yes, the very start of... Is this your favorite season?
Definitely not.
No, because it's too hot and you have to turn the AC on. So.
Well, this season is tricky. I always think in New York because it's not quite hot enough to get the air blasting, but then again, it's also kind of sticky if you have the window open. It's like hovering around 64, 65.
We're going to talk more about the weather after we take a quick break,
and weird.
We will return and discuss just how cold should you keep the office.
Oh, this is going to be a fiery debate. We will be right back.
Don't go anywhere. Plastic Fantastic will be right back.
I'm Tumani. When I was younger, I may have did some stupid things. I committed some crimes, but I'm not a criminal.
That's right. I'm Jamal. I work for youth advocate programs. Yeah, I was Tumani's advocate, helping him stay out of jail, stay in the neighborhood, get a job, and work hard to see a better future for himself. If you have a change of mindset, you can have a change of action.
As a little kid, I experienced trauma and I acted out. Made some mistakes, but I'm not a mistake.
No, she's a good student and a great kid. As Jalen's YAP advocate, I'm always here for her. With the youth advocate programs, I was able to connect with Jalen.
YAP is a community-based alternative to youth incarceration, congregate placement, and neighborhood violence. After completing our program, 86% of participants were arrest-free. YAP works.
And now, I'm a YAP advocate, helping kids like me find a better way.
Youth advocate programs. Others talk social change. We make it happen. Learn how at yapinc.org.
Generally, we celebrate with barbecues. We appreciate it.
So just say thank you for all you do.
Never miss an episode. Download Plastic Fantastic on Apple Podcasts, Spreaker, or wherever major podcasts are found. Simply search Plastic Fantastic.
Happy first week of summer, beginning of June.
It's actually technically still spring, isn't it?
Technically, if you believe
I don't believe that.
The astronomers? Who are those people?
The people that make the almanac. I don't know. The vernal equinox people.
Who tells us when we're supposed to officially start with summer?
It's Memorial Day, and it ends at Labor Day, right?
Exactly.
That's it.
So that's what...
Period.
Popular culture is so much more important than anything else, as we found out. And as we're continuing to find out, social media is much more important than all the years of learning and studying and memorizing and training and actually being a real plastic surgeon, because you can have any claim under the sun.
I don't even mind the social media stuff, but it's the claims on the social media that this is the only way to do it, and if you do this and you do that,
what's your favorite claim on social media? What's the one that drives you the most?
You know what it is. It's so easy. It's the deep plane facelift. I'm so sick of hearing about the deep plane facelift.
How many times do people ask you, which technique do you like to use?
So there's
Dr.
there's a trend going on right now in New York amongst a certain type of physician about deep plane.
Do you want to elaborate?
Facelifting.
What kind of
I'm not even going to go there, because you know what? There's a place in medicine for almost anything that we do, but to come out with statements like this is the gold standard and this is the way, haven't we learned by now that there's no such thing, and that the best part of being a surgeon and a physician is you learn all these different techniques and then you apply them to different situations.
If you're truly a surgeon.
Totally. just very briefly, there is a trend of the moment to talk about something called a deep plane facelift. And it's very funny. Less than 1% of all board-certified plastic surgeons actually even do this, even though board-certified plastic surgeons invented this and first described it about 25, 30 years ago. It is now back in favor, particularly on social media. The only thing I'm going to say is there are so many different ways to do a facelift. Talk to different surgeons, get their opinion. But if somebody starts telling you the only way to do this or the only way to do that, they're dead wrong. Look at your evolution with breast surgery, right? When you first did your training, we were doing a certain kind of implant. There were just 2 companies. There was 2 types of implants. In fact, there weren't even 2. There was just 1 because the gel implants were banned. And now the mainstay of your augmentation practice is really veering towards natural augmentation, which is the fat augmentation. That's just such a classic evolution of how you took reconstructive techniques that you learned, you applied it to something in aesthetics, and now you're on the cusp, basically, of teetering on the cusp yet again about
our favorite word,
the future of breast augmentation. It's a big thing.
And I think that's one of the things that we do as plastic surgeons. Not only do we train with all the different areas of the body from head to toe, literally, but we also work on all the different types of tissues. So everything from the skin all the way down into the bones. It's almost like the interdisciplinary approach to things where you use knowledge from one area and you apply it to something else.
It's one of the few fields left where that exists.
And we were talking about microneedling with PRP. So PRP, which is platelet-rich plasma, which has been around, again, used in a number of circumstances, medically speaking. Also by the orthopedic surgeons, they use it in joints where there's been cartilage injury. And for us as plastic surgeons, we use it in patients with burns. We use it to help with wound healing. And now we've adapted that procedure to the cosmetic area where we actually induce a small controlled injury zone, which is what we do with microneedling. And then we add the PRP, the platelet-rich plasma, which has all the growth hormones and, the growth factors, which really help with the healing process. And then you have tighter skin, more youthful-looking skin, get rid of some of the pigmentation, and just smoother skin, which is what characterizes a younger face and skin all over the body. So again, just the ability to know what you're working with and be able to use the creative aspects of the various tools and techniques that we have in different formats to help patients look better. And we talk about this all the time. Our purpose is to have happy patients, and we do it as cosmetic surgeons, as aesthetic surgeons, by making patients look better and addressing the things that bother them. When they look in the mirror, we help them feel better about themselves, and I think that's the most important thing.
Yeah, we're in the business of making people feel better, and we use what we do to hopefully make them feel better by looking a little bit differently, but more important, feeling a little bit differently.
And I think that's why it's also so important to have a number of different techniques at our disposal so that we can pick and choose. And even, as you know very well, since you're operating all the time and you have all this experience, when you're in the process of performing surgery, sometimes you'll change the plan while you're operating. And that's why it cracks me up when patients will say, well, which technique are you going to use? Well, I'm going to use the one that's appropriate.
Right. And we're going to see. For instance, people talk about a SMAS. How many times have you done a facelift where you get in there, you look at the SMAS and you're like, no, the SMAS is fine. Or no, the SMAS is dropped. I've got to actually do it. SMAS is a layer underneath the skin, by the way, when we do facelifts that sometimes can drop and sag in addition to the skin. And that's something that we work on as a deeper layer.
Hence the deep plane face.
I guess, hence the deep plane, whatever. A lot of the stuff, by the way, that you read is marketing. There was just recently a thing.
Sadly.
Yeah, there was a thing in the news about the Birkin lift and the Birkin body, and named after named after the famous bag, which is named after the model Jane Birkin.
Is there a keyhole in it? Or?
I don't know what it is, but it's as expensive. Whatever. There's so much marketing.
Oh, is that what it relates to? Is the expense?
Well, they're hard to get, so obviously it's going to be a surgeon who's going to say, "I'm so elusive, it's hard to find me," just like it's hard to find the bag.
Catch me if you can, kind of thing.
Exactly. Right? Settle down, as we like to say. Take it easy.
I wonder if they tell patients that they're going to look like Jane Birkin afterwards, because that would be...
Jane Birkin, early 60s, I get it. Jane Birkin 2022? I don't know. It's a different look.
Maybe not.
Maybe not. Maybe not.
I think it's very hard to make people look like somebody completely different.
I mean, I think most people probably look at social media with what we do and they do take it with a grain of salt. God, I mean, I hope so. If they don't, then we're in trouble.
It's probably a generational thing, though. It's like TikTok. And by the way, did you see there was an article about all these 65-year-old plus...
doing TikTok?
Well, they call them influencers or something like that, and it's like the older generation who is on TikTok, who they're all 65 years old or more, and they have I don't know how many followers, but enough where they would be called an influencer. I'm not really sure what they post. As you know, I'm not on TikTok.
What they're influencing. I'm not on TikTok either. That's a separate app.
Yes, it is.
It's funny. TikTok comes up a lot on Instagram, and I think it's just appropriated from their main app, and it's brought over.
You can see little videos. They show up on all the different platforms.
You know, one of the things we should talk about, and we've spoken about it before, is anytime you open even a newspaper now, like a style section or a fashion magazine or popular magazine, and there's a piece in there about cosmetic surgery or plastic surgery, you have to understand that is the result of a pitch meeting. And that is the result of PR firms. I don't know, lifestyle editor of some newspaper doesn't just pick up the phone and call randomly the list of best plastic surgeons in a certain city and say, hey, what's new now?
What is the list of best plastic surgeons anyway?
I don't know, but you're always on it.
It's interesting
to
see.
We're always on it, but yeah, exactly.
Well, sometimes they're peer recommendations.
Those are the only ones to pay attention to.
But then there's a whole bunch of other ones that are based on, as you say, marketing and claims and being an influencer. I guess you can be an influencer plastic surgeon, just like you can be an influencer fashion
by the way,
person.
and we should tell the listener, you pay for that. Don't think for 1 second that you don't pay for those. You pay for your PR person, you pay for your posting, you pay for all of that stuff to be an influencer.
Don't you want to be an influencer?
No, I don't.
You already are.
You and I have a
very,
very old-fashioned practice. It's word of mouth.
We're purists.
It's patient. That's right.
We're
still doctors.
We're going to call ourselves the purest plastic surgeons.
Wow.
So no bells
Got to
and
be
whistles.
careful with that. I don't know. We could get in trouble with that. The purist, I don't know. Doesn't leave room for imperfections.
Okay. Well, sure it does.
It's a high bar.
It's like being natural.
True.
It doesn't mean that you're perfect.
We're not originalists.
Shall we call...
I like that one too. That's always a great
As in
word.
constitutional law.
Totally. I love hearing about that. No, but we basically, it's word of mouth. We get our patients from other doctors that send patients to us. I know you certainly do, and I do. Our patients, word of mouth, thank God that we've been doing this long enough where we've got enough patients that have been happy to refer other patients, family members.
And by the way, you bring this up, but there's no such thing as never having a complication. There's no such thing as never having a patient who isn't happy with every single aspect of their surgery. There's always going to be room for improvement from our perspective, but there are also going to be instances where patients are dissatisfied for some reason or another. And the fact is that sometimes it takes more than one surgery. We do revisions, we do little touch-ups. There are things sometimes that you can't do in one sitting. There are aspects of surgery that would actually be potentially too risky, so you have to stage the operation, or you're limited by anything from the vascular supply, the conditions of the tissues, whether the patient has had surgery before. I mean, so many different things that go into our decision-making process.
And there are certain procedures that have a known revision rate. For instance, tummy tucks, abdominoplasty. There's a known revision rate of approximately, I think last time I looked, conservatively speaking, it's 10 to 15%, which means that after the appropriate postoperative period, like 3 months, 6 months,
depending on
the skin readjusts, it slides down, and you need to have a small revision, which happens a lot, particularly if, as you say, it's a massive change. In other words, a big floppy bunch of skin or a big lax loose abdomen that you now have to tighten up. You're right. You're never going to get it in one shot. You're going to have to come back and you're going to have to do it in a staged way. And sometimes we actually stage the planning. I mean, that happens a lot with body lifting and massive weight loss patients.
And it's amazing when patients forget what they looked like before their surgery.
All the time.
So they'll come in and they'll have, some minor complaint about, the scar here isn't perfectly flat, or it's a millimeter wider than the other one, or whatever it is.
Yeah.
And then you look at what we started with, because they're human beings, right? So at least my patients are human beings. I think our patients are still human beings.
By the way, there's also
forget.
a psychological thing that I think happens where the bar gets raised. In other words, your goal line changes from the minute you're operated on to the next. So you're no longer thinking of your pre-op look. You're looking at the way you are now.
The new you.
Which is a good thing. You're like living in the present. And now the new starting point is there. And that's why revisions happen. And that's why you do more. The new normal.
We will take care of our patients no matter what. So, but it's kind of funny when there are claims that are made that really aren't based on reality. So if you think it's too good to be true, it probably is. And other ridiculous statements of that nature that some plastic surgeons can do things that only they can do, I think is buyer beware type of situation.
Amen.
So you've been listening to Plastic Fantastic Show.
Does that mean it's over?
It's the dinner bell has sounded.
I always can tell when you're ready to wrap things up. You give me the choke sign like, okay, Rob,
give you the,
wrap it up.
We've discussed things long and wide enough. So we're going to bring this fascinating episode to a rapid conclusion. If you'd like to send us an email about this topic or any topic,
please
summer we were
do
talking
so.
about.
Summer or anything at plasticfantasticshow@gmail.com. Look for us on iTunes, Spotify, YouTube, Spreaker. We're everywhere. The Instagram. Anywhere.
Instagram. On social media of all types.
Somewhere.
We are the purest plastic surgeons.
Amen. The purest you'll find.
Thanks for listening. Have a great day.
You've been listening to Plastic Fantastic with Dr. Robert Silich and Dr. Olivia Hutchinson. Produced by Mike Scheck. This is Bill Eugene speaking. Got a question? Email plasticfantasticshow@gmail.com. And be sure to listen right here every week for another episode of Plastic Fantastic with Dr. Robert Silich and Dr. Olivia Hutchinson.